On this podcast, you'll find interviews with high-performing, successful individuals in life sciences. On a weekly basis, we cover their proven methods, principles, strategies, and mindsets to implement new technologies that scale to meet the needs of people in our world.
Welcome to the Life Science Success Podcast. My name is Don. And for those of you who don't know me, I'm a consultant in the life sciences, and I focus on helping companies reduce complexity and increase performance. Today, my guest on the podcast is Fungai Ndemera. Fungai is the CEO of Checkup Health. Fungai and I are going to talk about her journey to becoming a CEO, diversity, and we're also going to cover her focus as a keynote speaker. Welcome, Fungai.
Thank you for having me, Don. I hope you're having a good time. We are having the best heat here in the UK. So
yeah, it's pretty hot. It seems like everywhere. So hopefully everybody understands global warming is real. So can you tell the listeners just a little bit about yourself?
Thank you, Don. So I am Fungai Ndemera, founder of Checkup Health, and it's been a journey. I am on a path to creating healthcare digital and making healthcare accessible to all. And I've been an entrepreneur for the last 20 years, and I've been in healthcare since day one. I am a nurse by profession, by the way. So yeah, it's an interesting lifestyle.
Yeah, for sure. And so, just what is it that led you from, where you started overall? I believe you said before, whenever we talked previously that you were a nurse previously, and then, now you're the CEO of Checkup Health. So what led you to creating Checkup Health?
Yeah, so life is amazing, right? And life takes us on a path. And for me, that experience of being a nurse and then having to come to the UK and work as a nurse, I only worked as a year and then got here and started a healthcare recruitment business. But it was, I think the key issue was in 2004 when my father and my father-in-law passed away a week apart from my undiagnosed diabetes, and they were both non-hypertensive patients. That planted a seed. And I think when I look back, that's really when that thing was stirred in my heart to say, somebody has got to do something. And it's taken me many years from 2004 to just before the COVID, when we were just about to launch the digital healthcare platform when COVID happened. But so I believe that life experiences, they take us on a journey. And I think it's really important for us to look and search for what is it that I need to learn from these experiences, as difficult as they are, but what do I need to be doing? And I think for me, that ushered me to what I do now, connecting with dots of different things that have happened along the way, but really the beginning was then, I think. And now I can realize that, oh my gosh, this is what all this was leading me to be building a platform that's a one-stop AI-driven care delivery platform that comes with iOS and Android apps. And then it comes with a clinician dashboard that allows clinicians to offer healthcare digitally from wherever they are across the globe. And thinking that, would it have been my dad and father-in-law alive today? Maybe could their lives have been saved if there was a solution that could allow them to be reached in real time and be supported straight away without having to leave their houses and go to the hospital, So I think, yeah, life leads us to what we are supposed to be doing, but I think we need to be listening to what's been communicated through our experiences.
Yeah, I feel like that's been a rather consistent message that I've been hearing more and more lately. I don't know if it's just because I wasn't listening before, or if it's just the time in my life. But I feel like it's almost like we're led onto a path, and it's so strange to kind of look back and say, well, this happened, then that kind of sparked my interest in terms of, wanting to work in a particular area. So, glad that led you there. Can you tell us more specifically, what is it that Checkup Health does, and how does it, sort of, help patients get connected overall?
Yeah, so I think digital health has been something that has been coming our way. And I think in the UK, we have got the first movers, which are our Babylons and our Push Doctors platforms that allow patients to download an app or look for an appointment to look for a doctor who can then look after you when you've got a need to be seen. But what we've done with Checkup Health is that we have built it from a place of, okay, all these options are available, but what is it exactly that's available that speaks to me as a Black woman or as a Black person who needs healthcare? You realize that in the UK, currently, COVID-19 exposed the already pre-existing health inequalities that are available, that are around, which were never a conversation to speak about before COVID. But when COVID happened, we realized that, okay, we've got these existing health inequalities. And part of the issues is that the solutions or the healthcare that's out there, it seems as if it's for other people, but it's never for me, if that makes sense. So you don't feel included. You don't feel included, or you're part of the ecosystem, or you're part of the solutions, because they never really speak to you as a person in terms of the way they are designed, in terms of where they feel, in terms of languages that are available for me to access those things. So you find that as we are going digital, I have made a decision that I am going to be part of the people who are going to be providing solutions that are culturally competent and linguistically competent. What do we mean by that? Checkup Health has an app that patients can download to look for a doctor or to look for healthcare services, but actually it's multilingual. So it's taking into consideration other people that may not necessarily be English speaking people who could have felt excluded by other things that are available. That's number one. And then number two, they also feel that that's relevant to me. If I can read and look at it in my language, I can express myself better. Or I can also access people who look like me, who are going to understand my cultural needs when I look to be seen by a doctor. So there are a lot of things that we don't take into consideration when we are going digital. So, and I am deeply concerned that if we don't pay attention to those things, the health inequalities that already exist in the physical, we are literally just carrying them along with us. And those inequalities are going to widen, right? So Checkup Health is coming to say, okay, as we are going digital, this is a platform that is going to open the door and be a space through which other people who need to access services can also be accessing those services in a way that they feel they are included, basically.
And so to overcome the biases, I mean, I'm not very well versed in terms of how this happens, but I mean, do you have to involve those populations then to understand how things work and how they interpret things? Is that how you sort of overcome any biases that might be built in? Just curious.
Absolutely. Yes. So absolutely. So engaging the patient group or the population group that you are saying you are bringing a solution to is part of the design process, and consulting them and giving them to say, okay, this is what we are thinking of bringing to the market. We are thinking of having an app that's going to help you remotely monitor your health, your blood pressure, or your diabetes. So we want you to help us design this. That's how we've been doing it. So we have got teams of nurses and doctors where we have opened a center in Zimbabwe where we have patient groups that are diabetic and hypertensive. And we consult them and we understand them to say, tell us, how do you want us to do it? And then similar we've done in the UK when the COVID-19 hit, we applied for funding to Innovate UK, and we ran a feasibility study that included a patient group to say, okay, we are saying we can support you during COVID-19 to reduce the pressures of you wanting to look for an appointment to a GP. Can we give you devices? And when we give you devices, can you actually use them? Do you think you can actually use them? And so those kind of projects and studies are informing our technology development journey, so that we are making sure that the apps and the solutions are appropriate to that population.
Yeah, very, very interesting. I mean, I know, technology acceptance was a big part of my PhD as well. It was, the main thing that I sort of focused in on was, how do you get populations to to shift and leverage technology. And to me, it kind of brings me back a little bit in terms of, my thesis and, kind of the final, outcome, being, how do you shift or get populations that, find one method or another, easier. And now you're saying, you're also considering the diversity, so a lot more complex than even I had, considered in my studies. But for sure, an interesting, project, and an interesting company overall that you guys are working on. You also were
Yeah, and can
recent.
I and
Sorry.
I was gonna add as well that on that tone, I was gonna add as well a layer that it's things that we don't think about every day, right? So another example I can give you is that we are introducing AI elements to the way our technology and our apps and our systems for clinicians interact with the patients. For example, for decision making or for supporting them take a certain action when a certain result is recorded in the system, right? And so you will find that there is actually concerns that AI could be biased if, again, we do not consider certain responses that can be responding to one query or one situation. But if you took 2, 3, 4, 5 different people from different demographics and different roots and their answers are not going to be the same. So how are we thinking around making AI not biased? So for me, those are the things that interest me, because if we don't address them, we are carrying the legacy of problems that we have now into the digital, and people who are already excluded are going to continue to be excluded.
Yeah. And I know I received this question as well on a panel discussion that I was on. How do you prevent, AI bias, and the, you could say that, you train with diverse populations of data. You train the AI using diverse populations of data, and with that, I mean, okay, fine, you might actually overcome some of this, but in reality, you really need to be looking for the bias, and then also, making sure that you're countering it as well. Otherwise, for sure, you are doomed to repeat the previous bias that was already included. So, yeah.
Absolutely. Yeah.
And you were on a panel discussion with the Melan and medics panel. Can you tell us a little bit about what you were discussing there as a panelist?
Absolutely. So Melan in Medics is a not-for-profit organization being run by young, amazing Black medical practitioners. And for me, that's really another area where I felt that I could contribute, because like we are talking about the shortages in medical practitioners right now across the globe. And we have got the young population saying, okay, yes, we want to become doctors, but how our role is to support them, to help them understand that we need them in the digital space. Good example of what we've just discussed around the AI. And we need their contribution, and we need them at the table, especially in the tech companies that we are running. You need more practitioners of different ethnic minorities to be contributing to your design stage, to your delivery stage. And so my role on that panel was to bring awareness that becoming a doctor now doesn't necessarily only mean that you have to be a bedside patient managing doctor, right? We need you online. We need you in technology. We now need you everywhere. So your job has extended rather just from being a doctor that thinks about waking up in the morning, stethoscope, and going to see a patient on the bedside. But we need you to contribute on how we are going to deliver healthcare digitally, and what role you as junior doctors or as doctors you are going to play, right? And especially as melanin doctors, because we don't have enough of you. I was looking at the stats in the UK. We only have about 4% is the number of Black practitioners that are coming into the system as Black practitioners. Yet we need more, So yeah, it's interesting.
Yeah, or otherwise, I mean, I think back to your previous comments, right? I mean, otherwise you risk, continued, bias potentially, and just maybe not an approach that considers some of the things that could be going on. I mean, every population seems to have, different things that could happen with that population of people. And if you have only medical practitioners that are, you know, I don't know, white or Asian or, you know, of one particular race, then you could certainly, you know, shift or skew things in a way that it doesn't provide for an open mind in terms of care for those patients and the things that should be considered.
Absolutely.
Yeah, and so I mean, one of the things that I absolutely admire with you is for anybody that looks you up on LinkedIn, you have a fantastic social media team, or you know, you're doing some great work in social media, one of the two. And whenever I look at your LinkedIn page, there are oftentimes like pictures of you posted with, you know, some sort of thought-provoking question. And so I thought I would bring back a few of those questions here, and maybe we could, you know, just talk about them for a little bit. So one of the questions was, what are the best ways that a business could reduce health inequalities?
Wow. So I actually was on a panel yesterday, and I posted a post on my Instagram this morning talking the exact same topic. So I think first of all, it's important for us as a race to accept that inequalities exist. And it's shocking when you hear some people arguing, you know, just arguing that inequalities don't exist. And I'm thinking, how can you practically argue to that when it doesn't mean that if you are not experiencing it, it's not happening? So first
Mm-hmm.
of all, let's have that thought framework. If it's not happening to you, if somebody talks about something and you have not experienced it and you feel or you think that it's not happening, maybe keep that thought to yourself. But to disagree with them that it's not happening because you haven't experienced it, it's, I don't think as a leader, anyone who's in leadership should actually have that mind frame, right? So a starting point is to accept that there are things that happen and exist in inequality space that we probably are never going to experience in our lifetimes because they are not relevant to us, and
Right.
accept that fact. And then the second fact is that, you know, as you are a company owner or as you are a leader, allow people and give them room to have difficult conversations without judgment, and
Right.
just listen.
Right.
If you allow yourself to do that, you are going to learn a lot from people's experiences and from, you know, people, the way they think and they view and what they are experiencing. And then if you want to address those things, and then health inequalities being one of them, you've allowed yourself a framework and a platform that is going to inform your policy, and then implement a policy that includes everyone regardless of what things they may be experiencing, and then it allows them those things to be addressed each time they experience them, and then it's a learning process, continuously improving, you know. But we have to accept that these things, they are there, and allow us to have the conversations without judging anyone. You know, that's how I think.
Yeah, I grew up in a very small town in Indiana, and to us, culture was essentially, you know, going to the Chinese restaurant, or you know, experiencing some new type of food that, you know, was in a restaurant locally. And as I sort of started traveling globally, and my eyes were opened, you know, a little bit more, and I started to understand all the things that, you know, I missed. It's interesting to me how much more I wanted other people to understand. But also, whenever you're in that environment, it's hard to understand, because at the same time, you know, your mind just doesn't accept or understand that. But to your point, I mean, you at least need to kind of take a step back and say, even though you're not experiencing something, it doesn't necessarily mean that it's not happening to somebody else in the population of the world. So I completely agree with you.
Absolutely. And for me, I think the one thing that has helped me to kind of shape that perspective is that I travel a lot, you know,
Mm-hmm.
and me as a person, I am a mixed breed. So my mom is South African, my dad is Zimbabwean, and I now live in England. So I've got just one person, three perspectives of experiences. When I visit each country, I have to listen, understand, accept, observe, other people's way of lifestyle or way of living. But what that's doing, it's expanding my horizon of how us as a human race, we've got so many different things that are very different. But how do we allow everybody to be cared for and to be looked after in a way that's acceptable to them, without judging them? So it's kind of, it helps you expand your horizon, definitely.
So as a keynote speaker, what do you oftentimes, speak about whenever you're on stage?
Inequalities in whatever way, form, or shape. We have to have the difficult conversations, because the biggest issue is that you can't touch them. Sometimes you can't touch them, you can't see them, but you feel them. All right. So it's about allowing that conversation to happen, and say, whether it's in a workplace, whether it's at home, whether it's in school, it's wherever, we have a responsibility to push towards policies that support us as a race to address these things that have existed for a long time. And I think COVID has allowed us to realize that actually, these things exist and we need to have the conversation. So inequalities, but then, because I'm in the healthcare sphere and in the digital health, I'm now looking at, okay, how are we going to avoid the inequalities, especially specific to health, through digital transformation? But we have to make sure that our digital transformation strategies are addressing every single area of these, because it will be sad 10 years from now, 15 years, 20 years from now, we look back and say, we are all digital, but guess what? Those inequalities actually widened, and we haven't done anything to address them. So for me, that concerns me. And so, I'm comfortable talking about it.
Oh, it's very good. So there are three questions that I like to ask every guest. What inspires you?
I'm inspired every day by the thought and the understanding that when I wake up, it's an opportunity to make a difference. So it inspires me, the fact that I'm able to innovate, I'm able to create, I'm able to be the answer and be the change. That inspires me, and anybody who thinks that way. Yeah.
Very good. And what concerns you?
Inequalities. And why they exist, and why we have individuals and people who may think or believe that they don't exist. So inequalities, they concern me because they are very complex. They are made up of different elements of the society that shape somebody from the minute they are conceived in the mother's womb. Some people experience inequalities from conception, and then that follows them through the rest of their lives till they die. And that separates us as a society and puts us into groups. And we have a responsibility to bring that to a stop. And somebody has got to be, bridge the gap. Yeah.
Yeah, and I think it's, I guess I would carry it even further than like human, maybe even more than human inequalities. It's, this also carries through whenever it comes to, where we started, was how hot it is. So it could be global warming, could be vaccines, and, the effectiveness of vaccines, and whether or not, if science is really, essentially injecting microchips in all of us, or if we, really are getting a cure or a treatment. It just seems like these sort of inequalities kind of, could be divided up into, many, many more things where, you could also expand it to scientific inequalities, as well as, human race inequalities. And I know for sure I've had people work for me in the past that were, in the LGBTQ, realm, and similar sort of thing. And so, for sure they face those as well. Last question.
Yeah.
What excites you?
I think that for me, life, the fact that I'm alive, my husband nearly died of COVID in 2020. And that experience of thinking that we think that we have life, and we don't value life as much as we should and the opportunities that we have. But for me, COVID just kind of brought it really home to say, this life that we have is valuable, and we are here to make a change and make a difference. So what it is that can we be doing right now to be excited about every day, to wake up and make a difference? Because any minute like this, you're gone, and that's it. So for me, I'm excited to be alive. Every morning I wake up and do my best with the time that I have and what I have, and be driven by the fact that I want to leave a legacy when I'm gone. I want people to read about me and talk about me, and that woman who was crazy about inequalities. If it wasn't for her, we wouldn't be here. Because at the end of the day, I think that's what really matters. I think COVID for me is kind of, wowed me to say there is much more we need to be doing with the little time that we don't have. So, life is valuable that way.
Well, I'm glad that your husband is okay, but at the same time, sad to hear of the struggle. I know a lot of people, struggled through COVID, and some, didn't make it. And it truly is scary to see how fragile life is. I mean, it's just amazingly fragile. Well, Fungai, thank you so much for being a guest on the Life Science podcast. I greatly appreciated our time here. Thanks for joining me.
Thank you so much. It was so much pleasure, and I'm glad about the work that you're doing and taking these messages and spreading them across the globe, to make the world a better place. So thank you so much for having me.
Thank you. Thank you for listening to Life Science Success. For complete details about this podcast, including show notes, how to get in touch with guests, and more episodes, please visit www.lifesciencesuccess.com. If there's someone you'd like for us to invite to the show as a guest, please let me know by sending me a message at the podcast website. Please click subscribe on your favorite podcast app, share the podcast, or tell a friend about it. And last but not least, rate the podcast. Thank you again.